Welcome to week 2 of Aprendiendo, Juntos, Learning Together to Give Care. My name is Carol White. I'm a registered nurse and a professor at UT Health San Antonio. In this module, we'll discuss behavioral and psychological symptoms of dementia, also known as BPSD. We'll identify some of these behaviors, causes or triggers of the behavior, and then discuss together strategies to help you manage these behaviors. The behaviors you are seeing are a result of the function of the brain becoming more impaired as the dementia progresses. This impairment leads to disturbances in perception or how the person living with dementia sees their environment, disturbances in their thought, and in their mood. These behaviors can create significant challenges for both the person living with dementia and their caregiver. Some examples of common behaviors are refusal of care, such as bathing, dressing, or other activities of daily living, disturbances with their sleep, being awake all night or sleeping all day, wandering, and we know the research tells us that about 60% of people living with dementia will wander away from the home. Repetition can be a challenging behavior for caregivers, repetition of questions and of conversations. You may also see anxiety, agitation, depression, and then aggression, which can be verbal or physical. Caregivers report that the behaviors of dementia are often the most difficult aspects of care and can make the physical aspects of providing care much more difficult. As the function of the brain becomes more impacted, as we mentioned, individuals with dementia experience more difficulty understanding their environment or the world around them. Think about what it would be like to be not understanding the things that are happening around you or your environment. Familiar routines or places are no longer familiar, and as their language declines, it becomes more difficult for the individual living with dementia to express their needs and concerns. But because these behaviors seem to be a function of the environment, we may be able to change the behavior by changing the environment. For example, if there's too much stimulation in the environment and the person that you're caring for is becoming more and more agitated, reducing the stimulation in the environment and providing a more calming environment may also calm your family member. Behaviors can be a way that the person living with dementia is trying to communicate their needs. They are a symptom of the dementia, not the person. They are not a choice by the care recipient. Your family isn't behaving this way on purpose. There's always a reason or something that triggers the behaviors. When people living with dementia cannot effectively communicate their needs, including basic needs such as hungering or toileting or symptoms of pain or discomfort, it then becomes manifested as a behavior. For example, when your family member doesn't recognize their home or where they are right now, and they begin pacing or becoming agitated, stating that they want to go home because they're not recognizing the environment that they're in. So how can the caregiver manage the behavioral symptoms of dementia? Taking on the role of a detective in trying to determine the many things in the environment that could be possible triggers. This could be noise, bright lights, too many people, changes in routine. Triggers could also be medication side effects or unmet physical needs such as lack of sleep. Can you try to prevent these triggers by identifying what they may be? If you can't prevent them, what interventions can you try to modify the effect of the trigger and then evaluate to see if your intervention or strategy worked? Rudy, a caregiver to his wife and a member of our Latino Advisory Council, recognizes the changes in perception and thinking that his wife is experiencing as her dementia progresses. He states, "I need to validate her feelings and redirect. She is no longer in my world. I need to enter her world to try to understand what she is feeling and why." So the first thing when you observe behaviors is to think about physical needs. Is your family member in pain? Is your family member needing their hearing aids or glasses so they're not seeing their environment properly? Are they hungry, thirsty, tired? Remember we said they're unable sometimes to communicate their needs and they exhibit as behaviors. Are they on a new medication? Is there too much stimulation, competing noises making them to become more agitated? Or have there been too many changes in routine? Routine can be so important to the person living with dementia. In addition to physical needs, are there emotional needs being met? They may not always understand what you're saying to them, but they can understand how you say it to them. So are they being treated with dignity, including in the conversation, being talked to as an adult and not using baby talk? Are they feeling afraid, anxious, or sad? As we talked about, if they don't recognize where they are they afraid and anxious, leading then to more agitation? Do they sense anger or frustration in the people around them? Is their independence being supported? Are they given choices, or do they feel like all their choices are being taken away? So how to approach change? First of all, you want to work on one behavior at a time and look at, as a detective, what are the triggers that are maybe causing that behavior. So which triggers can be changed? For example, if you find that when it's mealtime, the person living with dementia isn't focused on the meal and is looking around and isn't eating. The TV is on, there's a lot of activities. Can you change that by having a more calming environment for the mealtime? And then start with communication strategies. Those can be the most effective strategies, how you're talking to people. And we'll hear more from Dr. Norman in a few minutes about communication strategies. And then try one strategy at a time and evaluate and modify as needed. And you may need to spend several weeks on a strategy before you do see a difference. The role of medications in treating behaviors. Medication should not be your first choice in managing behaviors. They may be necessary in some cases, but always follow guidance from your healthcare provider when they're using medications to manage behavioral and psychological symptoms of dementia. And they need to be evaluated frequently over time. But instead, try these other strategies first in terms of being a detective, identifying the trigger, preventing the trigger, evaluating what's working and what's not working. Modifying the environment. It's important, as we talked about, routine is so important. It's important to help your family member maintain consistent routines. And that routine should be based on what your family member is used to and what works best with them. You know your family member better than anyone, so you can help create a routine together that will work for them. And then if you do have tasks, some of the activities of daily living like dressing, bathing, consider placing those more difficult tasks at a time when your family member is at his or her best, which is often earlier in the day. So just to recap, BPSD, or behavioral and psychological symptoms of dementia, are symptoms of disturbance in perception, thoughts, moods, and behaviors that occur among people living with dementia. They are a symptom of the disease, not the person. The person is not able to control those symptoms. They are not a choice by the care recipient. They are best understood as adaptive behaviors, as how they're trying to adapt to their environment. So identify the trigger, intervene, and evaluate.